afternoon. My name is Terry Martin, and I'm the director of the East Chicago Health Department. I'm here today with Dr. Jerry Browning, who is the health officer for the city of East Chicago. And the East Chicago Health Department has been partnering with the Lake County Health Department and the Indiana State Department of Health to investigate a series of outbreaks of Shigella in the community and in the region. Dr. Browning, could you shed some light on Shigella and what it's all about?
Thank you, Terry. I'm here today to give some information about Shigella, or Shigellosis, as we in the healthcare industry know it by. Shigella is a really bad case of bacterial infection that can cause diarrhea in individuals depending upon the age of the individual. The effect of this bacterial infection can vary. We've had approximately 7 cases in the county and 4 confirmed cases of Shigella here in East Chicago. For the most part, Shigella cases will provide symptoms for an individual approximately 1 to 5 days after exposure. And the symptoms can vary, but often involve fever, abdominal cramps, diarrhea, of course, and that can be bloody diarrhea or non-bloody diarrhea. As well, there can be nausea, vomiting, and just an overall ill feeling. For the most part, if an individual or a parent of a child has these sorts of symptoms, they should contact their healthcare provider for proper treatment. Shigella is usually treated best with antibiotics. Most healthcare providers will ask the patient for a stool sample that can be cultured, and when the results of that sample come back and it's positive for Shigella, then specific antibiotics can be provided for the patient for proper treatment. In most cases, after a short course of antibiotic therapy, Shigella will be eradicated or removed from the patient's intestinal tract, and the patient will recover and the symptoms will go away. There are some cases where the symptoms have resolved and diarrhea is no longer present, but the bacteria can remain in a patient's system for up to a month after the initial exposure.
As is the case, doctor, as you know, prevention is the key to most illnesses or medical outbreaks. In this instance, prevention in the form of
hand washing.
Hand washing. Hand washing.
What I neglected to say earlier was that Shigella is a bacteria that's most commonly found in the intestinal tract of infected individuals. Mm-hmm. Therefore, hand contact with fecal material can spread the infection to others in the nearby environment. So we know that solid hand washing with soap and warm to hot water for 20 to 30 seconds is adequate to remove the bacteria from the hands and prevent further spread of this infection.
Wonderful, wonderful. I think one of the good things in this instance is that we've been on top of it and working with our local schools, our local healthcare providers, and making sure that we minimize the contagion and making the health department as a resource for anyone who needs to come in and visit our nursing division and get information and to be educated better about this disease.
Thank you, Terry. I really would like to commend you and the staff at the health department for being so proactive in helping the citizens that have had symptoms or have been definitely diagnosed with shigellosis to receive or be referred for proper treatment and to get some resolution of this healthcare problem. If this sort of infection gets out of hand, it can cause quite a problem for our citizens in this town. So, again, I thank you and your staff for doing all that you can to help ameliorate this situation.
Well, thank you, Dr. Browning. And if anyone has questions, feel free to call the East Chicago Health Department at 391-8467, and we'd be more than happy to answer your questions or provide information in the form of brochures to help you better understand how to prevent and treat if you have an outbreak of this situation.